So very simply, the purpose was to reduce the incidence and impact of AF-related strokes, and that we wanted to try and achieve that through a holistic approach to stroke prevention. The aims were to improve outcomes and quality of care for patients through the identification of opportunities for improving detection, identification and treatment. And there was deliverables that we identified as a group that needed to come out of this piece of work, this joint partnership working. And we recognised that there was a need for guidance for CCGs and practices, but we actually thought that more importantly, there was a need for a toolkit for commissioners, because they were the ones that were really going to move things on in terms of developing services. So, as I've said already, it was all about partnership working, and we recognised that each of the organisations would have a different part to play in the development of the toolkit. And obviously Julie has already talked about what the remits were for the AHSN and has covered some of that. They've played a very big part in investigating the technology, which of course you've had an opportunity to test out around the room today. And actually they have developed a framework which, in answer to perhaps Aidan's question earlier on, will maybe identify for commissioners that information that they really need to know. What's the evidence base behind those technologies? Importantly for the commissioners, what's the cost? But it's going to give them information that will help them to decide which one of those technologies may be worth investing in. Obviously, we've heard from UMesh that the AHSN facilitated some pilots, and one very specifically in his area. And they've also been very integral in sharing the education. And Julia's already mentioned about the online education that you know, we're keen for commissioners to consider, but they've also been supportive in looking at other options for training around AF. Public Health England, they were tasked to do some scoping, what's going on out there already, what's going on in terms of opportunistic screening, and they've also supported us in looking at other information that may be useful. How well are we using the opportunities within the NHS health checks in checking for checking pulses? And they've also looked at guidance and recommendations around incentivisation and the evidence base for those. Where did the clinical network come in? Well, the clinical network decided that they wanted to contract clinical leads and clinical lead supports to look at building this toolkit. And I was very fortunate to be one of those to be taken on, and I've worked very closely with Mammon. We've covered the work in Lancs and Cumbria, and we've had colleagues in Greater Manchester that were also appointed to do the work. So, as Mammon's already alluded to, we've looked quite closely at practice level data to try and understand where people are at in terms of screening and anticoagulating. And obviously Mammon shared some of that with you already. We've looked at guidance around anticoagulation and had a look at how well anticoagulation services are working. We've looked at raising awareness, and I think it's already been pointed out, we can't underestimate the importance of raising awareness. There are still people out there, even though because we're here today, we're passionate about it and we know about it, but there's so many people out there that really don't realise that association between atrial fibrillation and having a stroke. We wanted to look at training and education requirements and hopefully inform commissioners about what might be available out there. And then what we wanted to do was pull all of that together into a toolkit. So this is the contents of our toolkits. And we asked commissioners what they really wanted out of that toolkit, and what they said to us was they wanted a very user-friendly document. And so what we've done is we've pulled together a summary of recommendations, and that is contained within like a front document to the whole of the toolkit. And within that summary of recommendations, we refer you to certain other chapters or sections within the toolkit that you can refer to if there's something in particular as a commissioner you want to know about in terms of developments in your area. So we know that within a toolkit we've got to have some case for change, and that's within there as an introduction, if, so to speak. So why do we need to develop services? And we've heard an awful lot about that this morning, but there's more in there, and there's lots of evidence base in that section. Obviously, for commissioners, they really want to know about actually what's it going to cost them. So we've referred to the NICE costing tool there, and we've pulled out some very simple messages in terms of, okay, what can you expect to spend in a year? We've included information about costings for the NOACs, because we know this is really crucial for CCGs to be able to consider how much is it really going to cost. And so there's lots of useful information in there, and it also signposts you to the NICE costing template that will allow CCGs to enter their own demographic data so they can come up with very individualised costing for their own CCG. The expected outcomes. What we've done in this section is we've referred to outcome frameworks for the NHS, for public health, for social care, so that we can actually reference to the domains within those outcome frameworks that the commissioning of services will be relevant for. In the data section, we've signposted CCGs to infographics that's already been mentioned by Louise and Julia. We've referred them to the cardiovascular national frameworks of information that have recently been released earlier on this year, and also other data that we've collected throughout the course of our journey. In the detection and diagnosis section, we've identified some good recommendations about how we can make every contact count. And I think it's going to be very challenging for commissioners to think about not just how they can make it count in primary care, but how they might be able to use sequins and the like to make it count in secondary care as well. And we wanted that to be considered. We've also referred to the use of the GRASP tools in supporting case finding in there. So there's lots of other tools that can be referred to. The anticoagulation section is, of course, really important. Within our journey, Mammon and I have discovered that there are lots of variances in anticoagulation services across the patch, and we know that a number of CCGs recognise this and know that there's a lot of review to be done. So we've tried to give them, signpoint them to a point where they can recognise what a good anticoagulation service should look like. And obviously we've considered the NOACs in there too. Training and education, very important. Obviously Julie's referred to the online education. Mammon and I have actually also developed a programme of training that we've recently delivered in the West Lancs area, and within the toolkit we're going to provide links to our programme for that training with learning outcomes and evaluations attached to it, so you can get a flavour of what could be considered within a training programme. Technologies, obviously we've already talked about that. We've got the framework in there that the AHSN has developed. And then very importantly, we've included examples of best practice. We know that there's lots of really good work going on out there, and some CCGs have very kindly offered to share with us examples of specifications, business cases, reports that have shown where they've tried and tested things that have worked well that others might like to try also. That just leads me on to this last slide, which is this recently a released document by the AF Association around healthcare pioneers showcasing best practice report. And actually there's some really good reports in here that are going to give examples of best practice. There's going to be a link to this within the toolkit, and I'm really proud that a report that I submitted from the work that we'd done in Blackpool was included in that. And basically what we shared in our report was that we adopted a multidisciplinary approach. We've been working on this quite hard since 2011 in Blackpool, and it's really been a combination of our use of GRASP AF, the fact that we've had an incentivisation scheme around pulse checking in primary care, and we've also delivered an awful lot of training, and it's resulted in our AF prevalence climbing quite nicely from 1.6% in 2011 to 2.24% in 2014, which is quite a climb, and we haven't got a high elderly population, so we wouldn't have expected our prevalence to reach that height, but it has from all that screening. And we've also recognised an increase in warfarin prescribing from our work. It's gone up from a shamingly 40% in 2011 to over 60% in 2014. So we were very proud of our achievements, and we're very proud of being included in the showcase in best practice. However, there is that document within the toolkit to link into, and there's many more other reports that you might wish to look at there. In terms of where we're up to now with this toolkit, we have promised that a draft version will be available by the end of June, which is of course on Tuesday, and it will be. What we would like to do is, although we listen to our commissioners and we've tried to develop it to align with what they want, we are very keen that we ask them to take a look at it to be sure that it contains what they wanted. And so I think that we would like to do that before it goes live. And so we would very much hope that it will be live within a month or so. So it's Wash This Space, and it's going to be available on the Strategic Clinical Network website. So look out for it, and please take a look, and hopefully it'll be useful for you. Thank you.